It is possible that you will be kept in the hospital under a different section of the Mental Health Act if you need more treatment after your transfer direction ends. If so, you will be given another leaflet to explain this. What will happen if I have to go back to court? If you are on remand and have not yet stood trial, you may have to go back to court. The court will look at your case and may make a hospital order under the Section 37 of the Mental Health Act saying you should stay in hospital, or may give you a alternative sentence. The court can only make an hospital order if two doctors say that you have a mental disorder and that you need to be treated under the Mental Health Act. I can appeal. You cannot appeal against this Secretary of State or Justice decision to transfer you to a hospital or against remand by a magistrate court. But there are people you can ask to let you leave hospital. If you have not been given a restriction direction, you can ask the hospital manager to let you leave the hospital. You can do this at any time. The hospital manager are a special community of people set up within the hospital to decide whether people should be kept in hospital. The hospital manager may want to talk to you before deciding whether to let you leave. If you want to do this, you can write to them. You can also write to them, or you can ask a member of staff to help you contact the hospital manager. Whether or not you have been given a restriction direction, you can ask a tribunal to say that you should not be kept in hospital. What is a tribunal and what happens? The tribunal is an independent panel which can decide whether you should be allowed to leave the hospital. It will hold a meeting with you and with staff from the hospital who knows you. This meeting is called a hearing. You can ask someone else to come to the hearing to help you if you want. Before the hearing, the member of the tribunal will read report from the hospital about you and your care. One of the members of the tribunal will also come to talk to you. When can I apply to the tribunal? You can apply to the tribunal once at any time during the first 6 months after you were given your transfer direction. You can then apply once during the next 6 months, and then once in every year you are kept in the hospital after that. If you have not been given a restriction direction, your nearest relative can also apply to the tribunal once during the second 6 months after your transfer direction, and once in every year after that. This leaflet explains further down who your nearest relative is. If you want to apply to the tribunal, you can write to the Tribunal Service, P.O. Box 8793, 5th floor, Leicester, postcode LE1 8BN, telephone 0845 32022. You can ask a solicitor to write to the tribunal for you and to help you at the hearing. The hospital and the law society have listed as solicitor who specializes in this. You will not have to pay for help from a solicitor. With this, it is free of charge under the legal aid scheme. What happens if the tribunal say I should not be kept in hospital? If the tribunal says you should not be kept in hospital, it may mean you are taken back to prison or to a detention center unless the tribunal has recommended you to stay in hospital. What treatment will I be given? You're a responsible clinician and other hospital staff will talk to you about any treatment that you need for your mental disorder. In most cases, you will have to accept their advice. After 3 months, there are special rules about any medicine or drugs you are being given for your mental disorder. If you do not want the medicine or drugs or too ill to say whether you want them, a doctor who is not from this hospital will visit you. This independent doctor will talk to you and to staff at the hospital who knows you. The independent doctor will decide what medicine and drugs you can be given. Unless it is an emergency, these are the only medicine and drugs you can be given without your agreement. This independent doctor is called a SOAD, Second Opinion Appointed Doctor, and is appointed by an independent commission which monitor how the Mental Health Act is used. There are different rules for some special treatment like electroconvulsive therapy. ECT. If the staff thinks you need one of those special treatment, the rule will be explained to you and you will be given another leaflet. Letting your nearest relative know if you have not been given a restrictive direction. A copy of this leaflet will be given to the person in the Mental Health Act, say is your nearest relative. There is a list of people in the Mental Health Act who are treated as your relative. Normally the person who comes highest in that list is your nearest relative. The hospital staff can give you a leaflet which explains this and what rights your nearest relative has in connecting with your care and treatment. If you do not want this person to receive a copy of this leaflet, please tell your nurse or another member of staff. Changing your nearest relative. If you do not think this person is suitable to your nearest relative, you can apply to the county court for someone else to be treated as your nearest relative. Instead, the hospital staff can give you a leaflet that explains this. Your letter. All letters sent to you will be given to you. You can send letter to anyone except someone who has said they do not want to get letter from you. The letter to these people can be stopped by the hospital staff. Code of practice. There is a code of practice that gives advice to the staff in the hospital about Mental Health Act and treating people for mental disorder. The staff have to consider what the code says when they take decision about your care. You can ask to see a copy of the code if you want. How do I complain if you want? If you want to complain about anything to do with your care and treatment in hospital, please speak to a member of staff. They may be able to sort the matter out. They can also give you information about the hospital complaints procedure, which you can use to try to sort out your complaints through what is called a legal resolution. They can also tell you about any other people who can help you make a complaint. If you do not feel that the hospital complaint procedure can help you, you can complain to an independent commission. The commission monitor how the Mental Health Act is used to make sure that it is used correctly and that the patient are cared for properly while they are in hospital. The hospital staff can give you a leaflet explaining how to contact the commission for further help and information. If there is anything you do not understand about your care and the treatment, a member of staff will try to help you. Please ask a member of staff to explain if there is anything in this leaflet you do not understand, or if you have other question that this leaflet has not answered. Please ask if you would like another copy of this leaflet for someone else, please. Electroconvulsive therapy for a patient detained in hospital. Section 58A of the Mental Health Act, 1983. What is the leaflet about? This leaflet explains the special rules in Mental Health Act, 1983 about the use of electroconvulsive therapy, the ECT, to treat mental disorder. These rules are in Section 58A of the Mental Health Act. What is electroconvulsive therapy? ECT is a treatment used for a small number of severe mental disorders such as severe depression, mania, and catatonia. During ECT, an electric current is passed briefly through the brain, which causes a seizure, a fit. ECT is given under a general anesthetic, and patients are also given drugs to relax their muscles to avoid them hurting themselves during the fit. Usually, ECT is given in a course of 6 or 12 sessions by specially trained staff. If the hospital staff think it would be a good idea for you to have the ECT, they will explain what is it and why they think you should have it. Can I refuse the ECT? If you are able to decide for yourself, you do not have to agree to ECT. If you do not want it, you will only be given ECT if you won't agree to it, or it is an emergency. What if I'm under 18? If you are under 18 and you agree to ECT, a doctor who is not from the hospital where you are being treated will come and see you. This independent doctor is called a SOAD, second opinion appointed doctor, an appointed doctor by an independent commission which monitor how the Mental Health Act is issued. The independent doctor will talk to you and to staff at the hospital who know you. You can only be given ECT in both you and this independent doctor agree to it, or it is an emergency. What if the hospital staff think I am unable to decide for myself? The hospital staff may think that because of your mental disorder, you are not able to decide for yourself whether to have ECT. This means they think you cannot understand what ECT is, what it is for, and what its affected and benefit might be. If they think you are not able to decide for yourself, the hospital staff will ask in an independent doctor, a SOAD, to come and see you. The independent doctor will talk to you and to staff at the hospital who knows you. If the independent doctor agrees that you are not able to decide for yourself, the independent doctor can agree to allow the hospital staff to give you ECT. Unless it is an emergency, you can only be given ECT if the independent doctor has agreed. But the independent doctor cannot agree to allow the hospital staff to give you ECT if you have made a legally binding advance decision to refuse ECT under the Mental Capacity Act 2005, or someone else who is allowed to take decision on your behalf under the Act has said that you should not have it. This could be someone to whom you know, given a lasting power of attorney, a deputy appointed for you by the Court of Protection, or the Court of Protection issue this. Hospital staff can give you more information about the Mental Capacity Act 2005. What happened in an emergency? In an emergency, you can be given ECT even if neither you nor an independent doctor has agreed to it. But that can only be done if you needed to have ECT straight away in order to save your life or to stop your mental health getting very much worse. Code of practice. There is a code of practice that gives advice to the staff in the hospital about the Mental Health Act and treating people for mental disorder. The staff have to consider what the code says when they take decision about your care. You can't ask to see a copy of this code if you want. How do I complain if you want to complain about anything to do with your care and treatment in hospital? Please speak to a member of staff. They may be able to sort the matter out. They can also give you information about this hospital complaint procedure which you can use to try to sort out your complaint through what is called local resolution. They can also tell you about the other people who can help you to make a complaint. If you do not feel that the hospital complaint procedure can help you, you can complain to an independent commission. The commission monitors how the Mental Health Act is issued to make sure it is used correctly and patients are cared for properly while they are in hospital. The hospital staff can give you a leaflet explaining how to contact the commission. further help and information. If there's anything you do not understand about this care and treatment, a member of staff will try to help you. Please ask a member of staff to explain it. If there is anything in this leaflet you do not understand, or if you have other questions that this leaflet has not answered, please ask. You would like another copy of this leaflet for someone else. Supervised community treatment for Section 3 patients. Section 17A of the Mental Health Act 1983. Why am I on supervised community treatment? You are on supervised community treatment under the Section 17A of the Mental Health Act 1983 because the person in charge of your care, your responsible clinician, think you are well enough to leave hospital. But in concern that you may not continue with your treatment or may need to be admitted to hospital again at short notice for more treatment, supervised community treatment means that your care team will do their best to help you to stay well after you are discharged from hospital. But if your responsible clinician think you need hospital treatment again, you can be told to come back to hospital for the treatment you need. Your responsible clinician will talk to you about the agreement for the treatment and care you need for your mental disorder following your discharge from hospital. What is a community treatment order? The community treatment order is from that your responsible clinician and an approved mental health professional must fill it to say that you should be on supervised community treatment. An approved mental health professional is someone who has been specially trained to help decide whatever people need to be kept in hospital under the Mental Health Act. What happened after I leave the hospital? Your responsible clinician will talk to you about what happened on supervised community treatment. You will probably be asked to keep to certain agreement for your treatment or to other agreement to help you to live safely in community and to stay well. These are called conditions and are allowed under the Section 17B of the Mental Health Act. Your responsible clinician and an approved mental health professional must agree that these conditions are appropriate and will arrange any help you need to keep to them. You should talk to your responsible clinician if you are worried for any reason about anything you are asked to do or not to do while you are on unsupervised community treatment. What happens if I don't keep to the condition? If you don't keep to a condition, your care team will need to think about whatever you need to come back to the hospital for treatment. You must be told to come back to the hospital if your responsible clinician thinks this is the only way to ensure you get the treatment you need. Sometimes this may be necessary even if you have kept to all the conditions. This is called being recalled to hospital. If your responsible clinician think you need to be recalled to the hospital, your responsible clinician will tell you in writing that you need to come to hospital either straight away or at a particular time. If you don't come when you are told to, you could be brought to the hospital again, your will, against your will. If you are recalled to the hospital, you can be kept there for up to 72 hours if your responsible clinician think you need to stay in hospital for longer. An approved mental health professional will be asked to talk to you. This will all be explained to you at the time. What treatment must I have while on supervised community treatment? Your responsible clinician will discuss your treatment needed with you and will work out when and how you will be treated in the community. Can I refuse to be treated? You have the right to refuse treatment if you do not want it. But this could mean that your responsible clinician will need to consider recalling you to the hospital. If you do not want the treatment that is being suggested, you should talk to your responsible clinician as soon as possible. What if I am too ill to decide whether to agree to my treatment? If the people treating you think you lack capacity to decide for yourself whether to have treatment, they can give you the treatment they think you need. But they cannot force you to accept treatment if you are objecting to it, unless it is an emergency. Lack capacity means that because of your mental disorder, you cannot do one or more of the following four things: understand information given to you on the treatment, retain that information long enough to be able to make a decision, weigh up the information given to you to make a decision, communicate your decision by an possible means such as talking, using sign language, or even simple movement such as blinking an eye or squeezing a hand. Unless it's emergency, you also cannot be given a treatment. If you have made a legally binding advance decision to refuse it under the Mental Act 2005 or someone else into this allow you to take the decision on your behalf under that act, as said that you should not have it. This could be someone to whom you have given a lasting power of attorney, a deputy appointed for you by the Court of Protection, or the Court of Protection itself. The hospital staff can give you more information about the Mental Capacity Act 2005. Special rule about medicine and drugs treatment. Once you have been on supervised community treatment for more than a month, some special rule about medicine and drugs treatment applied. If you are being given medicine or drugs treatment for your mental disorder and it is more than 3 months since you have first given this kind of treatment while you were in hospital or on supervised community treatment, you will be asked to allow an independent doctor who is not from this hospital treating you, to examine you. The independent doctor is called a SOAD, second opinion appointed doctor, and is appointed by an independent commission which monitor how the Mental Health Act is used. This doctor will check the treatment is right for you and will talk to you before deciding what treatment you should continue to have. You can only be given medicine or drugs treatment that is independent, that this independent doctor has said straight for you, said right for you, unless it's an emergency. You will be told when and where the independent doctor wants to examine you. See, the independent doctor is one of the conditions of supervised community treatment. If you do not see the independent doctor at the time and place, you are told your responsible clinician may have to recall you to the hospital to see the independent doctor. These are different rules for some special treatments, like electroconvulsive therapy, the ECT. If the people treating you think you need one of these special treatments, the rule will be explained to you. How long must I stay on supervised community treatment? The community treatment order will last up to 6 months at first, unless your responsible clinician decide it is no longer necessary. You will be asked to allow your responsible clinician to examine you towards the end of the 6 months to see if you need to stay on supervised community treatment. You will be told when and where your responsible clinician wants to examine you. Senior responsible clinician for the examination is one of the conditions of supervised community treatment. If you do not see your responsible clinician at the time and place you are told, your responsible clinician may have to recall to you to the hospital in order to examine you. If the responsible clinician thinks you need to stay on supervised community treatment for longer than an extended, or it's up to you another 6 months, and then for up to a year at a time, your responsible clinician will talk to you about this towards the end of each period. Can I appeal? Yes, you can. Yes, you can. Ask the hospital manager of your responsible hospital to end your supervised community treatment. You can do this at any time. The hospital manager or a special community of people set up within the hospital to decide whether people still need to be on supervised community treatment. Your responsible hospital is usually the hospital you were in before going under supervised community treatment. If your responsible hospital change, you will be told. If you want the hospital manager to end your supervised community treatment, you can write to the hospital manager may want to talk to you before deciding whether to end your supervised community treatment. Your nearest relative can also tell the hospital manager that they want your supervised community treatment to end. This leaflet explains further down who your nearest relative is. If your nearest relative does this, your supervised community treatment will end after 72 hours unless your responsible clinician tells the hospital manager that you might be a danger to yourself or to other people if you stop being on supervised community treatment. If this happens, it will be another 6 months before your nearest relative will be able to tell the hospital manager again that they want to end your supervised community treatment. You can also ask a tribunal to say that your supervised community treatment shouldn't end. What is a tribunal and what happens? The tribunal is an independent panel which can decide whether your supervised community treatment should be end. The tribunal will hold a meeting with you and a staff who know you. The meeting is called a hearing. The meeting is called a hearing.